trickners. You must be tired of hearing that already, but um, I want to prove a point. As a psychiatric nurse, I am a proponent of mental health and mental disorder. You know, if those Binibining Filipinas girls have their own advocacies when they join the beauty pageant, I too have an advocacy, and that is mental health advocacy. I thank you. No, I'm kidding. But for my mental health advocacy, we need to have a hashtag. And my hashtag is hashtag it's okay not to be okay. That's our hashtag. Hashtag it's okay not to be okay, especially for us Filipinos, because we tend to mask our um, our true feelings, when we feel down, when we are in a bad mood, or we feel like we are a little under the weather, we tend to cover it up, and we still, manage to smile. But sometimes it's not really healthy to um, not express our true feelings. It's not healthy. So we need to just be true to our, excuse me, we need to be true to our feelings. In that way, we can fix the problems and find solutions. All right. And as a mental health advocate, I need, or you guys could join me. We need to um, stop these social stigma, you know, that fear, of social rejection or social exclusion, that fear of negative perception, even the fear of that we might ruin or destroy our family's reputation. And it is embedded in our culture, um, our belief system, the beliefs of super uh, natural or superstitious causes of mental disorder, such as witchcraft, like the aswang, or sorcery, or like the pangkukulam, and it is part of our belief system already. Instead of like seeking professional help, um, and most of our the people living in the rural areas um, try to seek folk or faith healers instead of going to like a mental avail, or trying to avail the mental health services offered by the government. Isn't it, we have like a mental health law that has already been passed? Correct me if I'm wrong, in 2018, you know. And also, there's practical reasons as well, for because like some of our from some people in the barrio does not have the financial capacity, so it's mostly financial constraints. And um, it could also be fewer access to mental health services. I know in Iloilo we have the Putotan. In Putotan, we have the mental health institution over there. And in Bacolod, because I'm from Bacolod City, so we I think we have one in Paglaom, or but it's a private mental institution. So um, those that does not have or has less or does not have enough money um, are hesitant to go there anyway. But the good news though, we already have um, vaccines. Okay, COVID-19 vaccines. I am fully vaccinated. I got the Pfizer vaccine. So whatever it is, whatever of COVID vaccine that's available in the market, please have yourself vaccinated. You know, we already weigh the benefits and the risk, and it's proven again and again that the benefits of getting the COVID 19 vaccine um, outweighs the risk. All right, and we need to have that. We need to go back to our normal lives, and the only way to attain that through the is by getting the COVID-19 vaccine. I just attended an education seminar. It's actually offered by our local nursing organization here that I am part of, the FANOGS. We had the education seminar 2 weeks ago, um, and the topic was a COVID-19 vaccine. The speaker was a Filipino immunologist from Baylor Medical University, and we specifically asked her. Her name is Dr. Tuano. We specifically asked her about the Beijing-based Sinovac vaccine, and she said because it's an inactivated virus, it's a dead virus, and she said it's safe. All the COVID-19 vaccines are very effective, and we need it. We need it for to start to go back to our normal lives, and um, we need to develop that herd immunity. Um, when we reach 70% of the population, if the population uh, 70% of the population are already been vaccinated, we will be able to achieve the herd immunity, and we will be immune to the COVID-19 virus. It's a Sinovac vaccine is a dead virus, inactive virus, like the flu vaccine as well. So you may develop some flu-like symptoms, but it's okay. It's okay. Our The bottom line here is we need to go back to our normal lives, and in that way, we will also be able to reduce the presence of anxiety disorder and depression. All right, I think that's the end of my PowerPoint presentation. Let me see. I'm just showing you the reference.